So let's see. So with that, I'd love to give a little bit of context on my background, and certainly to answer any questions that you have for me. So I currently serve as the head of healthcare policy at Lyft, as you noted, and it's a very unique role. It's a brand new role for the company. Many people, hopefully, on this webinar and beyond, recognize us as a leading brand, if you will, and being a reliable, affordable method of transportation for communities across the country. We recognize that we play a very large role in helping all communities across the US and getting access to transportation. And in thinking about our commitment to drivers and riders, it definitely makes sense that a company like this one would be venturing into the healthcare space, which we've done. And so I'm happy to talk a lot more about my background and the specifics, if you will, around what we're doing with Lyft Healthcare, if there are other questions, more specific questions even.
Yeah, well, we want you to just maybe start. I know that HCC was part of your path. Maybe you can just say, where you did your HCC internship and then how that experience influenced you, personally, and also kind of influenced your education and career background. I know you've done many things, including getting your MPH at Michigan and your DrPH from Harvard, but you had HCC before that. How did it influence your path, and where did you do your work?
Yes, so my HCC internship came at the right time. I discovered the field of public health in my first year at Spelman College, my alma mater, one of two historically Black colleges for women in the US. Very proud alum of that institution, given everything that it's been able to accomplish with starting out as an institution educating freed Black slaves in Atlanta, Georgia. And so I was at Spelman discovering what public health was all about by actually one day getting an email from the Bill and Melinda Gates Scholars Program, which I was once a proud recipient and grateful recipient of, in that they had extended coverage of their scholarship funding to the field of public health. And at that time, I was a confused pre-med chemistry major at Spelman and was realizing that I had a few other strengths and desires for my career. And so when I made the switch to sociology and public health as my field of focus, I started researching lots of internship programs, which led me to do what's called the Summer Enrichment Program in Health Management and Policy at the University of Michigan School of Public Health. And ultimately, when I found myself in spring 2007 at UC Berkeley as an exchange semester from Spelman to Berkeley to Cal, I discovered HCC. And that was my second opportunity to embed myself within the ranks of public health, to learn from public health leaders. So I worked that summer at the Alameda County Public Health Department in Oakland, and worked under Anita Siegel and Anthony Eiton. And I learned a lot. And this was 13 years ago. And I realized then that that health department in particular was uniquely situated to address health inequities and health equity, and thinking about really ground level training, if you will, on what a public health department does and why public health departments are really the cornerstone of our field. And it was a great experience, which then definitely helped me to see that I did indeed want to continue carving out my career in public health, which encouraged me at that time to apply to various MPH programs across the country. And I did ultimately choose to attend the University of Michigan School of Public Health, where my focus was health management and policy. And then thereafter, I worked immediately in federal policy at the US Department of Health and Human Services as a policy advisor in the Obama administration. And in those 4 years that I spent there, I worked on implementing the Affordable Care Act and several other federal initiatives around reforming our large and complex healthcare system. And then ultimately chose to go back to graduate school because of my funding as a Gates Millennium Scholar, which led me to the Harvard School of Public Health. And really, I was the part of the very first class, and actually the very first graduate of the Harvard DrPH program, as it was reimagined in 2014. So I finished that program in 2017 and then really reestablished my career, and would love to talk more about that as well.
Great, excellent. And then from your, just a little bit more about your HCC experiences, are there any lessons learned from your HCC experience that then sort of helped you to navigate some of the and deal with some of the barriers you faced along the way, either personally or professionally, in trying to improve health equity?
I think about the very specific training that I received as an HCC intern that summer. And I think about how the training was structured such that before we even started on day one within our internships, that you ensured, and you and all the folks who support the program ensure that we knew what the field was about, and that we had a crash course on public health. That was really, really helpful at that point in my career. And then furthermore, that we discussed health inequities, how pervasive they were, what was the source of those inequities, and really what some of the emerging solutions were, and really what were the policies and programs that we should be thinking of, that we should be implementing and conceiving of within the walls of our various internship sites. And so I took that thinking, I remember, into my time spent, my 2 months or so spent at the Alameda County Public Health Department. And I would say also knowing at that point that I was joining a field that lacked diverse representation. I would say in many ways, I use that information to be more bold and to be very vocal about my pursuits in the field as a young woman of color, and thinking about the lack of representation of what that means for my perspective in particular, not being reflected in leadership roles, if you will, both within public health and healthcare delivery. So I appreciated the grounding that I received, both in being selected for the internship, being prepared for, and then ultimately the ways in which you intentionally ensured that we were introduced to the various sites even that our colleagues and fellow interns were working within. And I really appreciated even that at that point, and I'm sure the program is still structured this way, I indeed had to host my fellow interns at my site and making sure that they understood what our mission was, what our priorities were. I remember how long I spent preparing for hosting that opportunity, and really how that was a leadership opportunity for me.
That's great. Yeah. And you use that as a great springboard to do many great things. So tell us about your role now with Lyft, and how, what's the kind of scope of your role, and what are you looking to, what are you in the process of accomplishing?
Sure, happy to. So I see my role as being focused on modernizing the non-emergency medical transportation sector. So we all recognize that healthcare is a very large, complex industry, and beyond that, non-emergency medical transportation is a very nuanced part of our system, but it is a perhaps underutilized benefit, if you will, both for the Medicaid and Medicare covered populations across the country. And so our role is to bring rideshare and or transportation network companies, as we're called, into this sector that's been around since the beginning of the creation of the Medicaid and Medicare programs. We're not just focused on people who have government program funding. We're also thinking about other vulnerable populations, including veterans and the like, and other patients who need more access to care. And so in thinking about medical transportation, right, it's one of the big three, as I call it, and thinking about the critical role that social determinants of health play in access to care for millions of people across the country. So thinking about how without access to proper medical transportation, it's estimated that about 6 million people miss a medical appointment each year.
Wow.
And I actually think that's grossly underestimated. But I do indeed agree with the estimate that lack of medical transportation access costs the U.S. healthcare system about $150 billion a year. So that it's a very sizable problem, right? So it's a perceived as being a narrow focused industry, and yet we have an outsized impact, if you will, on access to care, issues that we continue to need to address more for vulnerable and medically underserved communities. And so when we think about medical transportation, we know that having access to convenient, timely, and accessible transportation is very important. And that without proper access, we know that that we, without us playing a role, if you will, within our industry, that emergency room utilization would likely increase, which is an issue that we're trying to, of course, address as a system as a
Mhm.
whole. And there would be lack of access to important care. And we know that we're actually helping health plans, health systems, providers, et cetera, across the country to close critical gaps, clinical adherence gaps, if you will, around making sure patients have both access to specialized treatment, but also preventive care. So this benefit, if you will, is a critical lifeline for millions of patients, and thinking about access to dialysis treatment for patients who have end-stage renal disease and kidney failure, and thinking about pregnant moms, people who need regular access to mental health therapy and substance use treatment, things that have to go on even in the middle of a global pandemic. And so we at Lyft Healthcare are happy to play the role of being another form of medical transportation for patients who need it most, especially now that there's much more recognition of the importance of the social determinants of health, and how very deliberate integration of healthcare delivery and social determinants should occur. And I'd also say that I'm really excited about my role, that I've only been in now for 4 months, because, and I just realized this, I'd say, transportation was probably the first purposefully integrated social service that was integrated with the Medicaid program, because it has actually been part of the Medicaid program since the beginning.
Hmm.
So it's a benefit that's been around. Again, it's perhaps undervalued, and operates below the radar, but it's certainly critical for in thinking about the future of healthcare, especially post-pandemic, when we think about all the pent-up demand and how much people will actually need acute care services once we're on the other side of the pandemic.
That's terrific, and really timely, and really needed. Are there any examples of any kind of creative partnerships or programs that you've implemented, or that you have sort of ready to be implemented soon, that you're able to share?
Yes, there are lots of partnerships that Lyft Healthcare has built over the last 4 years with the mighty team that I've just joined. Most recently, in just the last month, we announced what we call Lyft for Epic, which is a capability that's now built into Epic electronic health records within hundreds of hospitals and medical providers and clinics across the country. And it's an actual button embedded within Epic EHRs
Wow.
for patients, whereby if any member of the healthcare team within that facility, whether it's a discharge nurse, a physician, a nurse, if it's noticed that, or rather screened purposefully and not just noticed, but that a patient has a need to have their medical transportation needs met, they can just click the Lyft for Epic button within
Wow.
that patient's EHR and hail the ride on their behalf. And we make it easy enough in that, just like for everyday consumers, that person within the healthcare system, that provider, if you will, a member of that patient's care team, can see exactly where the patient ends up going, can see the price of the ride, et cetera, with lots of transparency, if you will, around how that patient's specific needs were met.
That's fantastic, and what a large scale impact that you can have, in this role, and your company can have in this role. I know prior to coming to Lyft, you worked at United Healthcare, another sort of private sector company, and I'm wondering, in addition to what you just described that you're doing at Lyft, what roles do you see the private sector playing in advancing health equity and racial justice, at this time?
Great question. So, in sharing a little bit about my educational and professional background, I sort of left off at saying I graduated from the Harvard DrPH program in 2017. Thereafter, I actually went on to Minneapolis, Minnesota, and was hired as a director of strategic initiatives in our Medicaid division called Community and State. United Healthcare plays a role in Medicaid managed care in 26 states across the country. I learned quite a bit around managed care and how to best address the needs of Medicaid populations in that role. And then from there, I was hired to be Vice President of Corporate Social Responsibility nationally within United Healthcare, thinking about the needs of our Medicaid covered populations, Medicare, and commercially covered folks. And that was an awesome role in that it was first of its kind for United Healthcare, and it really was an opportunity for me to build on the vision of our former CEO of the company, who really wanted to double down on the mission of the company and thinking about the needs of medically underserved and low income communities. And at that point, we determined that the most strategic way for United Healthcare to get back to communities would be to double down on access to care issues and access to social determinants of health. So thinking about the many ways that both within the business and within the corporate arms of the company, United Healthcare could show up differently in communities. And I had the opportunity to build out my team, to oversee a multi-million-dollar budget and really think about investments that could be made in community, social investments that could complement what was happening from United Health Group's foundation that had been around for decades. We're really thinking about innovative and new programs that the company had not yet focused much more on investing in. And so it was an exciting opportunity. And again, it was there where I started thinking about transportation in particular, and that I was investing in various interventions that were meeting transportation needs at the local level, but those were sort of smaller scale interventions, if you will. And so when I found out about this wonderful opportunity at Lyft, I thought that it would be great for me to bring my talents to this role and to really focus on, again, the often overlooked social determinant that is the connection point to various other needs for everyone, right? We all need adequate access to transportation. So I certainly learned a lot around my previous role at United, and really in your question around health equity. I had an interesting opportunity to be part of the company's overall strategy around addressing health inequity, both for United Healthcare's 50 million members across the country and various other communities and people living in communities that United served. And I would say payers in the private sector in particular definitely have an outsized responsibility to address the issues at hand. It takes very robust, well-funded public-private partnerships to address all the disparities that are afflicting our country and communities of color in particular. I would say payers in particular have access to data that can really pinpoint where the gaps are, such that hotspotting can be conducted to really determine where there's both a need for more access to care, more access to providers, where various resources are just not being integrated or just not getting to the right to the right communities. And so I'd say, of course, in just the last few months, various sort of traditional players within the healthcare space have recognized that they've been underfunding health equity issues and health equity interventions. And I think there will be a lot more to come from large and small providers and payers in the future, and perhaps even seeing them come together in ways that they haven't before, and that they do sort of overlap in the people that they serve, the communities that they serve, and not just doing sort of one-off investments, but really thinking as a system, how they can co-fund and maybe even share, if you will, the data that exists around what works and why within certain communities, and how they can better streamline and not duplicate what they're doing, because we do need to share the resources a bit more, right? Recognizing that disparities in many ways are not being closed, and those gaps in care are not being well addressed. And I think we can all recognize that what we've been doing to date with health equity issues nationally and locally has not really gotten us to where we need to be.
Yeah, great. You've outlined a lot of ways that the private sector can play a role. And the importance of everybody pulling together, particularly at this time, to do that work. So obviously, you've had to navigate a lot of different types of organizations, a lot of different, both education and employers along the way. Just curious about what advice you have for HCC alums and for others who want to follow in your footsteps, and be a effective, impactful, inspiring public health leader. So what advice do you have for people from the leadership perspective, and are there any kind of lessons learned?
Yeah, from a leadership perspective, I often start with, doing the work, working incredibly hard at the thing that you're tasked with doing, if you will, in your everyday job. That's obvious. I'd say be bold in your vision on what it is that you want to do in your career. I've definitely had times, at times, have been told by various folks who I consider mentors or friends or colleagues, that I'm too ambitious with what I want to do. And that aside, I've at the same time had many mentors, and now I recognize that along the way I've had folks who've actually served in the role as sponsor to me, and really being deliberate in how they help guide me. But with that, I would also come back to the point around doing the work, and really being clear on what my goals are, what my strengths are, and what it is that I want to achieve. And again, being unshakable, if you will, around what those goals may be, and being bold. So what that has meant for me, for example, is starting a brand new doctoral degree that didn't exist, recognizing that I would be first in line to pursue that particular program. And I recognize now that it was a big leap of faith, but it didn't feel like it back then. I knew I wanted to take my educational training to the next level. I knew that I banked on the fact that I thought I would be well trained at the Harvard School of Public Health, that I'd have a good time. And I was right, but certainly that took a leap of faith. At the same time, that translates to what I do now. Some friends and colleagues even said, well, why would you leave the largest health insurance company in the country where you're building new programs that didn't exist, and have the opportunity to scale programs nationally, to go to this brand new player within the healthcare space? And the reason for me to do it was, you have to take risks. And I didn't think that it was a very big risk, if you will, because I did my research, and I really tried to understand what this new opportunity could help to bring about. And much like tying in what I was previously sharing around, the solutions for health inequities, we need more people sitting at these tables thinking about vulnerable communities. We need, people who don't consider themselves to be traditional players in healthcare to be part of these discussions as well. So that would be my advice to folks. Be very clear on what you want to do with your career. Identify the people who have the cool jobs that you're interested in. Reach out to those people. Be very clear on what it is that you're trying to seek out from them, if you will. And definitely seek out mentors, sponsors. Be sponsor ready. I'm learning this even more, that when it's time for you within a workplace setting to be sponsored by senior most leaders who can help you advance in your career, you definitely have to show them that you're very serious about your leadership journey. And again, do the work, and be bold, and then at the same time be open. So I could have never imagined that I'd be leading healthcare policy within a rideshare company 8 years ago, because this company didn't exist 8 years ago, and certainly didn't have a role to play in healthcare. So I've been very open, and have done the work, if you will, to demonstrate my seriousness around what it is I'm trying to achieve with my career.
That's great advice. This last question, we only have 2 more minutes, but just how do you take care of yourself in this process? Because part of being a leader, you have to give a lot, you have to work hard. Being bold takes, a lot of energy. And how do you take care of yourself? I know you also have a young family as well. How do you take care of yourself? And then any advice to students about that?
Terrific question. I would say COVID has made taking care of ourselves harder. I do find time and carve out time to do the things that bring me joy with my family and friends, including travel. And I I try to do the things that bring me joy even at work. So and really try to do things that I know I'm personally passionate about. And with that, and this is very cliche, but sometimes work doesn't feel like work because I recognize that I'm doing pioneering work, and really disrupting the healthcare system for the better. And when I show up at work, I recognize that I often I'm doing the thing I said I wanted to do long ago when I was just an undergrad, discovering this field. And so with that, I am joyful in what I do, but of course I get tired and think about how best to reboot. So still working on that, but do indeed do my very best to find time to do the things that bring me joy, um, both personally and professionally.
Well, it's been a joy to have you today, and it's been a joy to honor you as one of our 30 inspiring, impactful leaders, and just to see all the great leadership that you've done and the impact you've had. And we'll look forward to seeing more going forward. Thank you for being here today. Thanks for your leadership, and congratulations on being
Thank you.
one of our 30 inspiring, impactful leaders. And we'll look forward to partnering with you going forward.
Thank you, Jeff. Thank you for what you've done for our field. You are definitely an awesome mentor and visionary.
Thank you so much. All right, well, that concludes our program for today, and we'll look forward to seeing you on the next lunch series with our Journey to Leadership.
Take care.